Bad winter weather brings flu season, of course, and today some new numbers telling us just how bad it might be. By the end of 2013, the number of cases jumped sharply, going from 382 to 754. Then more than 1,100 by New Year's Eve. And more people between 20 and 64 years old are coming down with the flu compared to last year when seniors were hit harder. And Dr. Neil Rao, an infectious disease expert, joins us now from our Los Angeles bureau. Dr. Rao, can you say, based on what we know now, how bad this year is going to be in various areas in Canada?
Well, what we can say is that it won't be as bad as the pandemic year of 2009 and 10, but we clearly have not seen the worst of the flu situation in Canada. Alberta and BC and Saskatchewan seem to be leading, while Ontario and the Maritimes are still on the upswing and have yet to reach their peak.
So it's going to get worse in the east, and it might get a little better in the west in the next little while?
I think in the west, the flu-like activity will ultimately drop before it does in the east, but what we'll probably start hearing about is more cases of young children and even sometimes young adults, many with underlying disease but some without, ending up in intensive care units and on ventilators and maybe even dying. The deaths usually do happen after the peak rather than on the rise to the peak. But in Ontario and Quebec, I don't think we've seen the worst of it yet.
And a reminder for people, how do you protect yourself? Best way to do it?
Well, luckily, the H1N1 strain is contained in the year's flu vaccine. I think the biggest concern is that younger people often see flu as a disease of seniors for nursing homes and not of a concern for themselves. In places where the peak is yet to arrive, people definitely should get the vaccine because it takes 2 weeks for the vaccine to give protection.
Dr. Neil Rao from Los Angeles tonight, many thanks for your time, sir.
Thanks for inviting me.